Hi, I'm Dr. Brad Wenstrup. I represent the 2nd District of Ohio here in Congress. For those of you who don't know, the 2nd District runs from downtown Cincinnati through the suburbs and into the east along southern Ohio. I want to say thank you to the Arthritis Foundation for inviting me to speak today. I'm sorry I can't be with you, but I am grateful for the important role the foundation plays in providing resources and information to those impacted by arthritis. And I'm happy to speak to you today about my bipartisan legislation, the Restoring the Patient's Voice Act. I introduced this legislation with my fellow doctor and congressman, Dr. Raul Ruiz of California. So as a podiatrist, as a surgeon for over 25 years, I understand from personal experience how frustrating it can be to fight with an insurance company for the treatment that patients need. But that's what we do. We stand up on behalf of our patients, but it shouldn't have to be this tough. So one particular example is step therapy, or what's often called fail first. As you well know, when patients visit their doctors for a prescription, the treatments they are prescribed are typically based on a variety of personal factors, comorbidities, other entities that come into play as to what you can and can't tolerate and what works for you. Treatment plans by doctors are based on the individual's needs and their doctor's medical expertise and the first-hand knowledge of their patient's overall health. That's the bottom line. However, we see way too often what happens next after the prescription is the problem. So the doctor writes the prescription and it reaches the health insurer. And the insurer may refuse to cover it at first. Insurers insist on a one-size-fits-all step therapy protocol and require a patient to first prove that another medication, one of their choosing, not the doctor's choosing, will not work for them. That's what we're talking about with fail first. Now in this case, failure is not only an option, it's the only option before getting appropriate treatment, at least covered by the insurance company. So under the current system, patients are left with a limited set of options: either try a medication that's not what their doctor recommended for their condition, or pay out of pocket for the treatment that they need. This is wrong. Very often you may just be switching insurances, and then all of a sudden you're told you have to go back to a medicine that you tried before and didn't work for you. These decisions need to be made between the doctor and the patient. And I'm not saying the doctor doesn't have to have a reason for prescribing what they're prescribing, but they do. So too often with this process that happens, this leads to a delay in care, even health damage if a patient goes through step therapy and it's inappropriate. And when a patient fails to receive the proper treatment in a timely manner, their conditions can worsen. You know that. I often would get on the phone when I'm combating an insurance company, and I recommend that they see the patient. If they're going to decide what the care should be, I suggest that they see the patient. After those types of entanglements with the insurance company, usually we get our way. It can be much easier. And I've far too often seen the damage that occurs with delays in access to medication, which means a delay in care. And it can mean visits to the emergency room, additional surgeries, additional visits to the doctor, or repeating failed practices, which makes no sense at all. Step therapy is by definition a one-size-fits-all policy, but we know that every patient is unique. And only the doctor that treats you can understand that. That's why I introduced Restoring the Patient's Voice Act. It strengthens and restores the doctor-patient relationship by giving healthcare providers the final say in prescribing the right medication for their patients. It allows patients to bypass the step therapy requirements in certain circumstances. The Restoring the Patient's Voice Act requires a clearer, faster, more transparent exemption process to be available when a doctor feels step therapy would not be in the best medical interest of the patient. So this helps doctors bypass the extended debate that often happens with someone that never even saw the patient. This legislation would also require employer-based health plans to make the exemption process easily accessible on the insurer's website, including clear instructions and contact information for questions. Limits will be put in place as to how long a patient may be required to wait for a medication when an exemption has been requested. The goal of streamlining the process in this way is to dramatically reduce the amount of time and frustration spent on paperwork for physicians and patients. Also, we want to provide a better, faster process for getting people the individualized care that they need. Patients aren't one size fits all. Each one of you is different. Treatment plans shouldn't be either. My legislation addresses a targeted but serious problem facing patients, doctors, and our healthcare process across America. It's an important step toward restoring the doctor-patient relationship and ensuring healthcare remains patient-centered. If you still have questions about the Restoring the Patient's Voice Act, I encourage you to visit my website or call your representative. Thank you very much. Have a great day. Thanks for all you do.